Dr. Choll Kim here from sunny San Diego, California. We have to do a good job because this is one of my countrymen, an 80-year-old, I should say 80-year young CPA from Glendale with, oh, by the way, who's an avid golfer who has this spondy with severe spondylosis. That's a fancy term for arthritis. But more importantly, look at that huge disc herniation with stenosis. So he's got back pain and neurogenic claudication. He does not want a fusion because he's Korean and Koreans do not like fusions. Even though my mom did have a 2-level fusion and she still plays golf and she's 89. He wants the most minimally invasive surgery possible, and that would be the less procedure. A poke hole, interlaminar approach, discectomy, and any decompression as needed. So wish me luck, because after that it'll just be a Band-Aid. And it is a pretty blue. I have the recipe for this. Shot and save. Go left to right. Shot and save and swap. And I'm looking for any leakages out the back. Shot and save. Shot and save. This is really good for... This disc is kakapupu completely. Shot and save. I'm going to back this up a little. So this is not like a typical disc herniation. This is probably more of a disc osteophyte complex is my guess. Or a broken piece of annulus. Methylene blue with contrast media. And both those products are very ubiquitous. Shot. Shot. Wow. Yeah, it's very empty. Shot. It's a very safe, reliable docking point, and it's a very good bony landmark by which to reorient yourself. Oh no, look at that. That's perfect. I want to go straight in right there. You see that? Yep, I want to go straight in right there. Proximally, I'm going to be definitely proximal enough, maybe a little bit more. And then medially, I can easily get to the other side by going in right here. You see that? That red laser is the aiming laser. It is not the actual working laser. So as long as you know what you're aiming at, it's very safe because it's very precise. Here's the other cool thing. It is non-electrical. It's mechanical energy, so it will not shock the nerve like the trigger flex probe might. And it's really complementary to the trigger flex. It's really good at like rubbery tissue like the annulus, thin little bone, especially bone spurs, and disc annulus. Very gently. This is also called the San Diego pimple popping maneuver. And you have to be very, very careful here, especially if you have a big disc herniation, pushing the drill tube out. Yep, I'm just below the disc space. I still have to go low. And I want to basically sweep it away from me. There's the disc. See how it's bluish? Obviously. That's edge of ligamentum flavum. That's disc. That's probably the disc herniation. It's sequestered. That's why it's not blue, and it's got some calcifications to it. Call this the Steve Green?
Yes.
Right there. And look how medial I am. I'm not even pushing yet. I don't know if you saw that, but a big disc came flying out and hit me in the face. I'm speaking metaphorically, obviously. It hit this scope. But it was frightening, okay? It's like one of those scary movies. You forget. It's not real sometimes. And I bet you there's going to be a bunch more pieces come flying out of here soon. Look at that. I use the laser so much more now because you know what? It's pleasant. It's fun. Go in there, articulate up toward the dural tube, really gently, and just very gently pull toward me. And yes, I have one that goes in the other direction. We call that the salt and pepper because I use it as a pusher. Well, don't ask me why we call it the salt and pepper. We just do, okay? Look at this piece. I'm letting this scratch the undersurface as I go in because I want to get all the loose pieces out. I'm just going to push down on it. Yep. Hence the name salt and pepper because it's a pusher. Yep. Okay, I'm just past the midline. And I reached way over more. Can I have the regular tuitary? It does look like a fur. Usually doesn't have back pain associated with it. Look at this. Hold that. You know what it probably was when I pushed it down? This is going to be a little monster. It's not small, but it's not the biggest one we've gotten this year. Not even close. Very respectable, but we have multiple pieces, so maybe all added up. That makes so much more sense considering how big his disconation was on MRI. Oh, this is frustrating. Come on. I'd rather suffer. I videotape them all though. I've live streamed once. Put around 5 and I putter around for a couple of hours. Right there. That's at the midline. About halfway down the disc. Looking up at the end plate, right there. Yep, I don't think I need to go any more than that. So I also use the cannula. Can I have the regular tuitary real quick? I'm glad I did that. I thought I was going to be done. I'm almost done, guys. I'll take the laser. Magic wand. Aren't you wondering where all the pieces go? Because it looks like it's disappearing. The dural tube is a happy camper, except look how red it is. And there's my little friend. Can I have the regular tuitary? And I think I do want to look medial in the axillary space. To make sure I'm not missing anything. Because yes, I check my car alarm 3 times before I come in. I can't help myself. Oh yes, doctor, I'm feeling good. And there she is. Can I have a Valsalva maneuver now, please? Surgery's all done. We did it through a little poke hole. That poke hole is for the computer navigation tracking pin. That's the poke hole for the surgery. And it went, I don't know, let me think. Spectacularly is the word I'm looking for. So we're all expecting a great result and praying for a speedy recovery, so best wishes.